10 signs and symptoms of diabetes that you should be aware of. Number 1. Frequent urination. In diabetes, circulating glucose in the body is elevated. In an attempt to remove and decrease elevated blood glucose, kidneys excrete or remove extra glucose to maintain normal blood glucose levels within the body. This leads to frequent urination. Number 2. Excessive thirst. As kidneys excrete sugar from the body through the urine, fluid is attracted to the sugar and follows it out in the urine. As extra fluid leaves the body will release signals of thirst. This creates thirst and leads to frequent or excessive thirst. Number 3. Excessive hunger. Hunger occurs even though a person is eating. However, the glucose or sugar that is digested from the food and is now in the circulation cannot enter the cells of the body due to diabetes, in which the amount of insulin is severely decreased from the pancreas, the insulin-producing organ. As the sugar cannot enter the cells, the body is in still need of energy or sugar and will stimulate the sensation of hunger to bring in more glucose. This leads to excessive hunger. The 3 Ps. These 3, urination, thirst, and hunger, are known as the 3 Ps of diabetes. These are known as polyuria, polydipsia, and polyphagia. Urea refers to urine, poly refers to many or much, so polyuria would mean much urine, or frequent urination, or polyuria. Dipsia refers to the desire for water. Poly refers to many or much, so polydipsia would mean much thirst, or excessive thirst, or polydipsia. Phagia refers to eating too much, or to devour. Poly refers to many or much, so polyphagia would mean much eating, much devouring, or excessive hunger, or polyphagia. Number 4. Unexplained weight loss. Even though a person is eating, the glucose or sugar that is digested from the food cannot enter the cells of the body, which means it cannot be used for energy. The body requires energy, so it then begins to use an alternative means. The body begins to burn fat and muscle as an energy source. As fat and muscle begin to be used for energy, a person begins to lose weight. Remember, glucose levels remain high in the circulation from food, and thirst and hunger continue, and these are the reasons mentioned in the 3 Ps. Number 5. Fatigue. As the body is attempting to remove sugar from the blood through the urine, and then creating thirst and hunger, and food cannot be used as a primary energy source in the body cells, and fat cells and muscle cells are being broken down, this creates more work for the body. The body is then dehydrated, thirsty, and hungry, and the body still has to move, walk, and work, leading to fatigue. Number 6. Blurred vision. In the small blood vessels of the eye, excessive sugar can cause damage. That can cause swelling of the lens of the eye. When the blood glucose first becomes elevated, vision can become blurry. When treatment begins, vision could return to normal. However, with continued high blood glucose levels, it can lead to permanent eye damage, leading to blindness. Number 7. Delayed or slow wound healing. Elevated blood glucose due to diabetes begins to cause damage to blood vessels, and diabetes can affect the immune system, which is responsible for fighting infections. If the immune system is compromised, and circulation is compromised, and blood glucose levels are elevated, this may not allow normal glucose and adequate amounts of nutrient-rich blood necessary for healing. Also, glucose is a food source and creates the ideal environment for infectious organisms such as bacteria, viruses, fungus, and yeast. If glucose levels are not controlled and healing is delayed, then small wounds can lead to big infections, ultimately leading to amputations if in the legs, feet, toes, and hands. Number 8. Numbness and tingling in the hands and feet. As mentioned with delayed healing, normal blood sugar is necessary, and this is also true for nerves to function properly. As circulation to nerves becomes compromised by elevated blood glucose, nerves are first slowly irritated, then damaged, resulting in the sensations of numbness and tingling. Similar to the eyes, if blood sugar is controlled early on, this could return to normal. However, if blood glucose levels are not controlled, damage progresses, leading to pain and neuropathy, where nerves can ultimately be destroyed, leading to lack of any sensation or loss of sensation or feeling. Number 9. Yeast and urinary tract infections. As mentioned, diabetes can affect the immune system, which is responsible for fighting infections. If the immune system is compromised and circulation is compromised and blood glucose is elevated, this may lead to a glucose-rich environment, which is necessary for organisms such as yeast to thrive, like in the mouth, skin folds, and vagina. This can also happen within the urinary tract, such as the urethra, bladder, and kidneys. Number 10. Skin changes, dry and discoloration. Elevated glucose can deprive the circulation of the proper nutrients that can help keep skin healthy and nourished. This can lead to itching, dryness, and cracking, which allows access for infections to occur. Also, as blood glucose levels rise, the pancreas struggles to produce the necessary insulin, and cells become resistant of the insulin, weight gain begins, polyphagia occurs, glucose cannot enter the cells, weight gain occurs, and the cycle continues. This is insulin resistance. A physical sign of insulin resistance is acanthosis nigricans, which is characterized by patches of dark skin, sometimes with a thick and velvety texture in areas of the neck, armpits, elbows, knuckles, and groin. This can also occur in other conditions such as obesity and hormonal disorders. Let's review. Ten signs and symptoms of diabetes you should be aware of. Number 1, frequent urination. Number 2, excessive thirst. Number 3, excessive hunger. The 3 P's, polyuria, polydipsia, polyphagia. Number 4, unexplained weight loss. Number 5, fatigue. Number 6, blurred vision. Number 7, delayed or slow wound healing. Number 8, numbness and tingling in the hands and feet. Number 9, yeast and urinary tract infections. Number 10, skin changes. If you have any of these signs and symptoms, please be sure to talk with your doctor. Be sure to like, subscribe, and share this video. And until the next video, thank you for watching.